Well, we've been living through the COVID pandemic for more than a year and a half now. The number of cases, deaths, hospitalizations, and surges, followed by downward trends, have been all over the place at times. But the question remains for health leaders, when will it be okay to get back to life as normal? Fox Med Team's Dr. Mike is live. As long as we're not hitting you with a tough question, right, Dr. Mike? When can we just get back to normal, and when will this whole thing be over? That's an easy question to answer.
Well, if I had a crystal ball, I could be actually accurate in my answer, but I will give it my best call here, all right?
Okay.
I think it's going to be a year or so. Here's the way I think it's going to play out, and many experts in the field, epidemiologists and people that study this sort of thing, kind of predict that over time we will see highs and lows. The winter months concern a lot of people. There's going to be almost pre-pandemic levels of travel for the holidays. And I think that we will see an uptick in numbers of COVID-19 and perhaps the flu this year. But I think over time, Dave, we're going to see more and more people get vaccinated, more and more people who aren't vaccinated getting the virus, and that's how kind of pandemics work their way out, to the point where most people have some immunity, and COVID-19 will be relegated more to a nuisance, and we'll look at it in terms of the boxes of Kleenex that we're using rather than the ICU beds that we're occupying, and that's down the road. Could it be a year, 2 years? COVID-19 is never going away, but I think that it will become more of a nuisance. That's my prediction.
Well, we certainly look forward to that day. In the meantime, of course, we've seen more and more things open, and just frankly, we've seen so many people sometimes pay it no mind, no attention, no precautions whatsoever in this current state of being opened up. And then, of course, people taking just seemingly every precaution, probably still this year very scared for travel and other things. So people's reactions to this are all across the board as well.
No question about it, Dave. Everyone has kind of had their own personal pandemic, if you will. Bottom line is this. Look, you want to be as safe, and I have a phrase that I've been using since day one. I don't fear this virus. I respect this virus.
Right.
And when it comes to COVID-19, you want to be smart. It's a smart virus, and we can outsmart it. We can be smarter. And the way we do that is by being careful. If you're inclined to get a vaccine, which I would hope that you are, all right, that's step one. Step two, you're in with a large crowd, you might wear a mask. That would be like a smart thing to do. And then for the holidays coming up, here's my recommendations. If you're going to go see grandma, and it's really, really important to see grandma, maybe you haven't seen her in 2 years. If you're going to go and you're vaccinated, cool. If you're not, then I would suggest that you test yourself with a rapid test before you go in the house. And secondly, you wear a mask.
Yeah, absolutely.
Because you don't want to knock grandma off. You don't want to knock her off. You want her to be around for next Thanksgiving.
Absolutely.
You know?
Absolutely. Totally agree with all those steps. And I will say in closing, it is nice to be in a better position now, or I certainly feel that way than we were a year ago at this time heading into the holidays, certainly with the vaccine so available and everything. We're heading in the right direction.
Dave, everything always gets better. You know, all my exes live in Texas. That's why I live in Tennessee. And everything gets better, man.
That's right. Well,
Not bad for a Yankee, huh?
Well, that's good. Hey, all George Strait references are welcome here. Dr. Mike, thank you so much. We appreciate it, as always.
Thank you.
Good to talk to you.